A patient crashing from septic shock in the intensive care unit. A hiker gasping for breath during an asthma attack. A severe seasonal allergy flare-up making a patient's eyes swell shut. 3 entirely different medical crises, yet rescuing a patient from any one of these emergencies relies on interacting with the exact same microscopic mechanism. Mapping this specific physiological switch allowed researchers to design drugs that target specific tissues, moving medicine away from generalized treatments towards receptor-specific interventions. That master switch is the GQ receptor. Think of it as a specialized sentry embedded in the cell membrane, waiting for a chemical signal to trigger a cellular response. The GQ receptor activates PLC, which acts like molecular scissors to cut PIP2 into fragments IP3 and DAG. Following the pathway right, IP3 triggers the release of stored calcium from the endoplasmic reticulum, while DAG activates PKC. That sudden flood of internal calcium enforces one unbreakable physiological command: squeeze and secrete. It forces smooth muscle contraction and glandular release. To map where this happens, we use the Have One M&M memory set. This top banner outlines the 6 major receptor types: histamine, alpha-1, vasopressin, angiotensin II, and muscarinic 1 and 3, triggering this cascade. If a physician needs to control smooth muscle tension or glandular secretion anywhere in the body, they must target one of these 6 specific receptors. We can group the first 3 as vascular clamps. These use the GQ calcium flood to physically squeeze blood vessels and manipulate circulatory resistance. Look at the red alpha-1 box. In septic shock, norepinephrine activates this receptor. The calcium spike clamps vascular smooth muscle, raising blood pressure to maintain perfusion. Conversely, blockers like prazosin prevent contraction. Vessels relax, blood pressure drops, treating hypertension. When alpha-1 isn't enough, the body relies on the V1 receptor as an emergency backup. Drugs like vasopressin target this specific switch to rapidly drive up systemic vascular resistance during a severe code. Then we have the AT1 receptor. This mechanism combines intense GQ-mediated vessel clamping with long-term sodium retention driven by the RAS system. Administering an AT1 blocker, like losartan, disables this signaling. The calcium signal halts, dropping cardiovascular afterload and reducing the strain on the heart. Whether pulling a patient back from shock or managing chronic high blood pressure, the primary tool is the manipulation of vascular GQ receptors. Moving away from the circulatory system, we find the GQ pathway used for immune defense. This is the domain of the H1 receptor, the trigger for localized inflammatory responses. In the blue H1 box, you see the results. Histamine activation increases vascular permeability. Fluid dries into the tissue, causing the swelling, itch, and edema of allergic reactions. This is why we use medications like diphenhydramine or cetirizine. These drugs act as specialized H1 blockers. By locking the receptor, they shut off the internal calcium signal. The gaps in the blood vessels close, and the allergic reaction halts. The relief of an allergy pill is achieved through the targeted biochemical interruption of the GQ squeeze and secrete command. The final group manages automatic operations. These are the muscarinic receptors, M1 and M3, driving the autonomic wet and squeeze functions. M1 maintains control over the central nervous system and the stomach. Administering a broad blocker like atropine cuts off the signaling, reducing gastric acid output. On the right, the yellow M3 box outlines control over bronchi, bladder, bowel, glands, and pupils. In an asthma attack, lungs squeeze shut. Administering a blocker like ipratropium turns off the M3 switch, relaxing bronchial smooth muscle so the patient breathes. Conversely, drugs like pilocarpine or bethanechol stimulate the GQ pathway, forcing glandular secretions to fix dry mouth, or inducing bowel contractions to restart a stalled digestive tract. Whether opening a constricted airway or restarting a paralyzed gut, the clinical strategy remains the same: toggle the M3 calcium switch. By understanding the GQ pathway and the Have One M&M targets, pharmacology stops being a memorization game and becomes a predictable system of biological management. But if GQ acts as the gas pedal for squeezing and secreting, physiology requires an equivalent set of brakes. That counterbalance operates through a different receptor family, summarized by the mnemonic MAD2. M2, alpha 2, and D2 act as the shutoff valves, powering down the cascade before these contractions become dangerous. From the ICU to the pharmacy aisle, these microscopic calcium movements inside a single cell dictate the macroscopic survival of the entire body.